Okay, let's move into some of the studies that have been shown or done on tryptophan in humans, and some of the benefits of using tryptophan in humans. So we see here depression, cognitive function, sleep quality, gut immune balance, migraine sufferers, chronic pain and chronic inflammation. There's been research on all of these things. I'm going to pull some of these studies up for you, and we'll just talk about a few. Here we go. Let's dive in. So you can see here, tryptophan. These all come from a large review paper on research done with tryptophan. But tryptophan's been found to be as effective as tricyclic antidepressants in a number of trials. References here. And one study found that the effects of tryptophan and amitriptyline alone and in combination were all superior to placebo. So as effective, I love this because a lot of times you'll hear doctors say, oh, that nutrition stuff's nonsense. It doesn't work as well as medications. And there's so many examples of studies where natural agents work as good as drugs and sometimes better, but in this case, as effective as tricyclic antidepressants for the treatment of depression. Here is a nice review on the role of tryptophan metabolites in neuropsychiatric disease. And you can see several different types of conditions. The condition listed here on the left. TRP stands for tryptophan. So tryptophan supplementation significantly declined the number of events that needed intervention. And here we're talking about schizophrenia. You can see tryptophan supplementation improves mood and decreases hallucinations in patients. So if you know somebody with schizophrenia struggling, you may talk to them about tryptophan. Supplementation could considerably decrease aggressive, pugnacious behavior without any impact on mood or agreeableness. We know that tryptophan supplementation enhances dominance, helpfulness, and affiliative responding. This is for mood disorders. And for hypomanic disorders, disease improvement after receiving tryptophan supplementation. Sleep disorders, tryptophan supplementation processes excellent potential to decrease the latency to sleep as a hypnotic for chronic insomniacs. I know in my own practice, when we have people that are struggling to sleep, tryptophan is one of the first things I pull off the shelf. Of all the sleep aids that I've ever used clinically, I haven't found one really that's more helpful than tryptophan in non-habit forming, because a lot of the sleep aids, like if you've used melatonin as an example, you'll wake up groggy the next day or kind of out of sorts. Tryptophan supplementation doesn't do that. If you're using something like valerian or chamomile, if you take too much, those can make you groggy the next day or lethargic the next day. Tryptophan doesn't do that. So as a general rule of thumb, in my opinion, it's one of the safest things to take to help with sleep with virtually no side effects. So anyway, back to this. So mild depression, tryptophan supplementation, significantly effective in treating mild depression. So this, again, just a research review of numerous human studies on tryptophan. And then we have here, you can see tryptophan has been used successfully in the treatment of seasonal affective disorder, what they oftentimes refer to as SAD, seasonal affective disorder, and maybe as effective as light therapy. In one study, who met DSMV criteria for recurrent major depressive disorder with seasonal winter patterns, treated with light therapy for 2 weeks. The treatment for those who were partial or non-responders to this light therapy were then augmented with tryptophan. The dose was 3 grams a day for 2 weeks, and they found tremendous improvement in the 3 gram a day dose. Half of the patients showed significant improvement during both treatments, regardless of the order of the treatment. So light therapy worked well, tryptophan therapy worked well. So think about this. If you live in the north and you struggle every winter with this, ideally you want to think about a light box that you use during the winter months. You can get one of these. You can buy these at local retailers. You can buy them on Amazon. They're relatively inexpensive, generally around $80 in the US for a good, what's called a 10,000 illumination box or 10,000 lux. If it's that strength, it'll work really well in the winter to prevent depression. But then you can consider coupling that with tryptophan. 3 grams a day was the dose used in this particular study. I've seen it be effective in people everywhere from 1 to 3 grams a day. Some people do better at higher doses. Some people don't need quite as much. Another study down here, Steinberg and colleagues conducted a randomized double-blind placebo-controlled trial to assess the efficiency of tryptophan. They were using 6 grams a day, and they were treating premenstrual dysphoric disorder. Basically, they were treating premenstrual problems. And so patients receiving tryptophan reported significant reduction in dysphoria, reduction in mood swings, and in irritability compared with those receiving placebo. So it worked really, really well for women with premenstrual problems. And going back to, you can use 6 grams of tryptophan. You can eat tryptophan in your diet. It's very easy to eat more tryptophan. So those of you struggling with these psychiatric problems, consider how much protein are you getting on a daily basis in your diet, and of the protein that you're eating, how rich are the tryptophan sources of protein. We're going to come to food in just a minute, but I want you to always consider that as a precursor to supplementation, because food is easy. Food, we can just add it to the diet, and we can a lot of times knock it out. We've got here, in patients undergoing smoking cessation, tryptophan at 50 milligrams per kilogram per day has been used in combination with high carbohydrate diets and is reported to reduce anxiety and severity of withdrawal symptoms. So if you're trying to kick a habit, you may consider looking at tryptophan as an aid to that, and to improve abstinence or reduce the number of cigarettes smoked. So smoking cessation, tryptophan had benefit. We have this study on tryptophan. Elderly often suffer from sleep disorders and depression, which contribute to mood disorders. In our previous work, we showed that elderly individuals with mood disorders had lower intake of tryptophan. And we see this a lot. Elderly, as you get older, you eat less. There's a pattern. When you eat less, your stomach shrinks. Your stomach shrinks, you want to eat less. But ultimately, what's really low in the elderly is protein as a whole. And this is one of the reasons why the elderly start to develop sarcopenia or muscle loss and bone loss as they age. It's not really an age decline so much as it is an eating less leading to shrinking of the stomach, leading to reduced protein, etc. It's kind of a pattern that just pushes that person over the edge. But it also affects the mind, because the mind needs protein. Remember, all the neurotransmitters are derivative of proteins. And the mind needs protein to get to them. So in this case, we assess the impact of tryptophan-rich diet on the mental state of depression and sleep disorders, and an equal number of elderly subjects without mood disorders. In conclusion, dietary consumption of adequate amount of tryptophan has a beneficial effect on mental health of the elderly with mood disorders and improves metabolism of this amino acid. Therefore, tryptophan-enriched diet may be considered as a component of the treatment of elderly individuals with mood disorders. How many of you have an elderly loved one who doesn't eat enough, especially doesn't eat enough protein? Or maybe they've had a nutritionally ignorant doctor who said, don't eat the animal protein, it increases your cholesterol, makes you have heart disease. All that nonsense rhetoric we've been suffering through from people who don't understand nutrition. And now we're at this, we see our elderly at this state in their life where they're just wrecked as a result of bad dietary advice. Okay, you can see here, kynurenine is known to be involved in acting as an ultraviolet filter which protects the retina of the eye from UV damage. So this is, remember we were talking about the kynurenine pathway? So tryptophan makes the substance kynurenine, and this substance protects the eyes from ultraviolet light, and they believe that it may in some individuals play a role in cataract formation when you don't have that protection. So There's the thought that tryptophan actually protects the eyes from excessive UV photooxidative damage. Some of you were asking about cataracts in a recent show, and maybe that information's helpful for you. You see here, tryptophan has been used for the treatment of sleep disorders and is thought to produce its therapeutic effects through melatonin mechanisms, as we said earlier, melatonin mechanisms. Improvement in sleep latency has been reported with doses as low as 1 gram. This is what I usually put people on, is 1 gram. Usually you start with 1 gram per night, and you take that about 30 minutes before bed as you're trying to support that sleep. An important feature, actually, let me back up here. Improved sleep has been reported with doses as low as 250 milligrams. An important feature of tryptophan treatment is that, unlike many other medications administered for sleep disorders, it does not limit cognitive performance or inhibit arousal from sleep. Tryptophan also produces significant improvements in obstructive sleep apnea. So, if you've been diagnosed with this, not central sleep apnea, but obstructive sleep apnea, if you're overweight and you struggle breathing, tryptophan can help you sleep better. So 2.5 milligrams of tryptophan administered effectively helped people with obstructive sleep apnea. So giving you the dose there too, you can do with that what you will. There are some considerations we'll talk about here in a moment. If you're going to supplement tryptophan, some things you should just be aware of. So here we have, in this particular study, where they were looking at the effect of a tryptophan-rich breakfast. So this wasn't supplementation. This was just simply eating foods higher in tryptophan at breakfast, along with light exposure during the daytime. And so here's what they found. The study is the first to report the quantitative effects of changed tryptophan intake at breakfast combined with daytime light exposure on melatonin secretion and sleep quality. Evening saliva melatonin secretion changed significantly and indicated that a tryptophan-rich breakfast and bright light exposure during the day promoted melatonin secretion at this time. So we want that. That's how we go to bed at night. And in this case, the amount of tryptophan rich in the diet was 476 milligrams in the meal. So, if mainly that's a serving of meat. If you really want to think about it in that way, how many kids are eating breakfast cereal? How many adults are eating breakfast cereal, for that matter? Mostly cornflakes or other poor nutritive value, low protein, low tryptophan value foods at breakfast for their primary meal.